Hello, once again welcome back to our channel. This is Geetu Chandra and you're watching Geetu Chandra Vlogs. In today's video, we'll be discussing about the electrolyte imbalances, especially the sodium imbalances. Do you feel it's difficult to learn hyponatremia? I have some tricks and mnemonics for the easy learning. Let's watch the video for easy understanding. So let's move on to the video. Hyponatremia. So let's move on to the topic in detail. The main contents of these topics are the definition, types and causes, signs and symptoms, and the treatment. So let's move on to the topic in detail. Definition: hyponatremia is defined as a serum sodium of less than 135 milliequivalents per liter. The normal range is 135 to 145 milliequivalents per liter. So, what is the role of sodium in the body? This is an electrolyte that regulates water inside and outside of the body. Water loves sodium. So, the hyponatremia refers the sodium level that is less than 135 milliequivalent per liter. So, let's move on to the types. There are mainly three types according to the volume status. So, we can categorize into euvolemic hyponatremia, hypovolemic hyponatremia, and hypervolemic hyponatremia. So, in euvolemic hyponatremia, here the water level is high and the sodium remains the same. What happens if the water level is high? It leads to the dilution of sodium. So, there is a high level of water, but there will not be any edema. So, the main causes of this euvolemic hyponatremia is SIADH, that is syndrome of insufficiency of antidiuretic hormone. Okay, syndrome of insufficiency of antidiuretic hormone. And DI, diabetes insipidus. DI is diabetes insipidus. And adrenal insufficiency. These three things can contribute to euvolemic hyponatremia. Okay, then hypovolemic hyponatremia. Here, see the term hypovolemic hyponatremia. Here what it means: hypovolemia, the water level is low and the sodium level also low. And the causes of hypovolemic hyponatremia are the vomiting, diarrhea, diuretic therapy, burns, excessive sweating. Listen these causes. These causes can contribute to low water and the low sodium together. So this can leads to hypovolemic hyponatremia. So clear so far? So let's move on to another thing. That is, the third one is hypervolemic hyponatremia. Here what it indicates: hypervolemic, volume overload. So here what happens? Water is high and the sodium is also high. What it indicates? Hypervolemia, volume increases and it leads to a volume overload. So the sodium gets diluted and there will be edema. Listen the thing, edema. In euvolemic there is no edema, and in hypervolemic here edema is present. And the causes are congestive heart failure CHF, kidney failure, and the liver failure. Clear so far? According to the causes and volume status, we can categorize it into three types: euvolemic hyponatremia, hypovolemic hyponatremia, and hypervolemic hyponatremia. So let's move on to next topic. And the signs and symptoms. How you can remember the signs and symptoms of hyponatremia? I have some mnemonics for that. Just remember salt loss. See here, one bottle is present and the salt is scattered. So remember this thing in your mind. Sodium is related to salt. So salt loss. Let's see the signs and symptoms. SALT, salt. So with that, S for stupor and coma. A for anorexia, nausea and vomiting. Here stupor and coma. The patient will be in the coma stage. Maybe it can be a sign of hyponatremia. Anorexia, nausea and vomiting. If patient is having hyponatremia, it can lead to the signs and symptom of anorexia, nausea, and vomiting. What is anorexia? Anorexia is loss of appetite. Nausea is the sensation of vomiting. Nausea is the sensation of vomiting, and vomiting can also occur. L for lethargy. This is a muscle weakness. The patient can also experience muscle weakness. T. T for tendon reflex decreases. The patient's tendon reflexes will also decrease in this case. So let's see the another slide, that is loss, salt loss. LOSS. L for limb weakness. See, L for limb weakness, easy remembering. I am telling this quick easy word. O for orthostatic hypotension, and S for seizure and headache. Seizure is abnormal electrical activity that is occurring in the brain. S for seizure and headache, and S for stomach cramps. This patient also will experience the stomach cramps. So thorough with the signs and symptoms. Just remember salt loss. So let's move on to another slide. The treatment for the hyponatremia. The main treatment for hyponatremia is watch the cardiorespiratory, neuro, renal and GI status of the patient. So we have to watch for the cardiorespiratory, neuro, renal and GI status of the patients so that we can understand what are the signs and symptoms, what are the causes, and according to that we can provide the treatment for the hyponatremia. It may be hypovolemic, euvolemic or the hypervolemic hyponatremia, so that we can provide treatment according to that. In hypovolemic, administer IV sodium 3% saline hypertonic solution, 3% NS. In this case we are giving 3% NS for the patients with hypovolemic hyponatremia. Okay, this can be given through a large bore needle, for example the patients with central line, and it is given in a critical care setup, so can be given in ICU, so it requires critical care monitoring. So hypovolemic, what can be done here? In hypovolemic, restrict the fluid intake, diuretics, and restrict the fluid intake can give diuretics. So see the hypovolemic, the volume overload will be there. To balance the thing, we will be giving diuretics for the patients, and some cases they will go for dialysis. SIADH. Instruct the patient to take sodium rich foods like cheese. SIADH, that is syndrome of insufficiency of antidiuretic hormone, and that can be treated with antidiuretics, that is SIADH. Okay, clear so far? So here ends the topics. Thank you so much for watching. If you didn't subscribe our channel, please subscribe and press the bell icon for the notifications. If you really like our content, please support us with a thumbs up. We'll meet again with another video with an interesting topic. Until then, it's bye from Geedu Chandra.